Start.
Hello,
Hello.
this is Dr. Gabler, doctor in the medical clinic today. Are you the son of Mr. Andrew Garfield, 68-year-old?
Yes, doctor, I am.
And how can I address you?
My name is John.
Okay, Mr. John, we are here today to discuss your father condition and
Yes,
what we
doctor.
can do
I
for
just eagerly want to know what is happening with him.
Can I know how much you know about his condition?
Doctor, my father had a condition called COPD, and this has worsened this time, and he was taken to the hospital. And after that, his condition worsened again, and he was shifted to the intensive care unit. And I don't know what happened after that.
Okay, Mr. John, unfortunately, your father condition has worsened more and more during his stay in the intensive care unit. He was connected to artificial machine to support his airway artificially. Are you aware of that?
Yes, doctor. So how is he now, doctor?
I'm so sorry to tell you, Mr. John, but his condition not good.
What do you mean by that?
That treating team, they try all the way to manage him with the best available treatment, but his condition continued to deteriorate.
Cannot you do anything for him now?
Mr. John, I'm so sorry to tell you, but your father condition is so poor now, and the treating team expect that his condition will shorten his life.
Okay.
So,
So we need to
so
give you some
the,
medication so you can get better.
the treating team with the specialist consultant, they assess his condition very well, and they found that the part of the brain who control all the breathing and heart in the brain is already dead.
What does this mean?
This means, Mr. John, I'm so sorry to tell you, but your father technically dead.
Death? But he is breathing, doctor. I saw him that he is breathing.
Uh, I appreciate your feeling, and I'm sorry for all the suffering you having now. But this breathing he has now because of the artificial machine, and once we stop the artificial machine, his heart rate soon will stop after.
So cannot you keep him up some more days so that he will get better again?
Mr. June, your father condition studied very well by the treating doctor, and they confirmed that the important part of the brain already dead, means your father technically dead, and nothing can bring him back.
Oh, doctor, that is so bad news for me. That means you mean
I'm
that
so
he is dead, but because of machine he is alive.
Yes, Mr. June, I'm sorry to give you all this bad news today,
Oh, doctor, that
but
is so much.
but but
He was my lovely father. I don't know what can I
I'm
do.
I'm so sorry. Now the treating team decided that they will withdraw all the artificial machine gradually for him.
Doctor, that means just like killing him.
Mr. John, I'm so sorry, but this is his condition, and he is technically dead, and will start to remove all machine from him.
Oh, doctor, is he on pain? Is he suffering from pain?
I assure you, Mr. John, but he doesn't feel anything because, as I told you, his brain dead means he don't feel anything.
Okay, doctor.
Mr. John, can I ask you if your family and your father discuss in the
Remaining.
before about in case his condition deteriorated, what he think for the future? Did he give any advance wish or living will, or did he assign anyone to take decision for him in
No,
case he is
doctor.
not able to take decision? Okay, Mr. John, do you have any more concern for me?
So that when you can take him home, doctor.
Soon after our meeting, we'll start to remove all machine, and it takes minute to hour to
Time up.
and thank you.
Okay. In this case, you have done very well. Again, you have taken so much time to tell that this is a case of brain death.
But it is bad news. I need time to process.
And you told me about at 2.5 minutes later. That was so much time you are taking. So you know that this condition is bad. Okay, and we are sorry. We have assessed him regularly, and we found out that his condition is very bad at this time, and actually his was seen by the senior doctors, and they find out that uh, he his brain is dead. And then give a pause for a few seconds. And do you have any idea about that? No. What do you mean by the brain death? Okay, actually, brain death means that the brain is cannot work, is not working at any, and also the parts that is that regulates his heart, that regulates his lung for breathing, that all are damaged. And actually, I am sorry to say that it brain death actually means that he is dead. I'm sorry to say that. You could go for that at a very short early stage. You said that his condition is not good, his condition is very bad. That means I was getting some hope that his condition is bad, but he will do something. Actually, he's dead. So you could say at early stage condition has worsened, so that you will get much time to ask more concern. Okay. Patient party already knows that his father is on the ICU, so you could just say, okay, his condition is ICU. His after coming, his condition was not improving and was getting much worse and worse, and due to this condition, his condition came to the terminal stage, and our team has examined him and find out that his brain is dead. So you could tell it at a very early stage, within 1.5 minutes. Do you get me?
Yes.
You were giving some hope that his condition was bad, his condition is bad, his condition is very bad. I was thinking that okay, his condition is very bad. We know it happens. It happened to him before. After a long time, you said that brain death, and after saying the brain death, you should ask the patient, but if they know what is brain death. After that, you can say that this is actually technically death, but due to the machine support, he's getting those heart rate, getting those uh, breathing. But that is all due to the machine. He's not doing anything. Okay, because time management is very important, and for this time, otherwise, if you had time, you could say lots of things before giving the bad news.
Because I I feel difficulty giving from the first shot that the brain dead and
Not
he's
first, not after patient said that he knows about his father's condition. Okay, after that, you could give just a short summary that after coming to the intensive care unit,
and
his condition was getting
I
worse.
felt that I performed very well, and this is the best my performance ever.
It took a lot of time. Other you took lot of you did very well, excellent, but it took lots of time. But if you had time, you could ask a few more concern. You could ask. You could get few more thing to ask more, and even you could answer all the questions to the patient, right?
Yes.
You did excellent. You don't have to worry that you did something wrong. You didn't miss any point. Just you took a lot of time. Time management is the best management here. Start.
Hello,
Hello.
is Dr. Gabra the doctor in the medical clinic? Are you Mr. Andrew Garfield, 68 year old?
Yes, doctor, I am.
Okay, Mr. Andrew, we are here today to discuss your condition and what we can do further. Is that okay with you?
Yes, doctor. I just wanted to talk with you about my condition.
Yes. So before we proceed, how you feel now about your condition and your lung
I
condition?
am okay, doctor, now, but I had this type of acute attack frequently. And so that I went on some website, some internet research, and I found that there are some options called transplant of lung that can give cure this condition. So I just want to talk about that option. I think you will be able to give answer to the questions.
Mhm. Okay, Mr. Andrew, I'm glad that your condition is improved now. About the lung transplantation, uh, you- there is a lot of information you need to know about it. Do you want to know about it?
Yes, doctor. Just one thing that will I get cure with this?
Uh, Mr. Andrew, there is a possibility that your condition will improve, but you should know first that not every patient is eligible for the lung transplant. Your condition will be studied well by the medical team and their specialized team for transplantation. They will study your condition, and if you are eligible, they will put you in the list, waiting list for lung transplantation, because the lung for transplantation not always available. You will be in waiting list, and maybe you need to wait some time until you get it. Do you get me, Mr. Andrew?
Yes, doctor. I can get it now. Does it gives the total cure to the condition?
Mr. Andrew, every procedure has good thing and bad thing. The good thing from the lung transplant that you will feel some relief from your symptom. Your maybe your exacerbation rate of your condition, your attack will be less, but this not guarantee. In many condition, the body cannot tolerate this foreign lung, because this lung come from different person, and there is a failure rate for this lung transplant. Do you
Something
get me,
worrying.
Mr.?
Yes, doctor. That is a worrying thing. Will it hamper my lifestyle anyway, doctor?
Uh, Hamburg. What do you mean by Hamburg, Mr.?
Just after the getting the lung, will I be able to free to do anything, or will I have to follow a strict lifestyle?
Mr. Andrew, you should know that after getting the lung transplant, you should be under medication for life. This medication, it's very strong medication. It suppress your defense system. So you will be given clear instruction maybe you need to change your lifestyle, your nutrition, your exercise, your lifestyle, and maybe you will be more exposed to infection, to bug infection. Do you get me, Mr. Andrew?
Yes, doctor.
And one more thing, I want to tell you that lung transplant will be, you will need a big procedure and operation. This maybe takes an hour, and it consider as a big operation, and it have a failure rate, and maybe there is risk during this operation.
1 minute remaining.
Any more concern, Mr. Andrew?
Oh, doctor, yeah, that is somewhat worrying, but I thought that it will cure my condition. I will get fine.
Mr. Andrew, I'm sorry if I don't relieve your feeling, but you should know everything about the operation, the bad thing and the good thing. Do you want to know anything more about this?
I can get some water. How long it can take to get the lung, or can I know anything better about this condition so I
No,
can take decision later? I am scared
no,
after hearing all those.
no, no one can expect the timeline because you will be in waiting list, and once available, you will be invited for. And I will provide you with website and
I'm
leaflet
up.
to read more about it.
Yeah,
Thank you.
okay, thank you. So everything was fine. Just patient needed to know some pointed answer. For suppose like will there be any change in my lifestyle? Okay,
Yes,
so at that time you should have said
I,
okay.
I I tried to answer him, but maybe not good answer.
You could give some information because this was about his lifestyle. He just wanted to know about lifestyle. Okay. For that, your answer was fine, but there are also some other motivation that is okay. You will have to follow a strict lifestyle, and you will have to stop the smoking if you do any, and also you will have to take the regular medication. You will have to be on regular follow up. That medications have side effect. We will also follow up that. You will need to get regular review. So this will, and also there are some certain acts that cannot be done with this transplanted lung. So there will be a restriction in your lifestyle also. It's not a straightforward thing that you transplant and you are free of this. Okay,
Mm.
solely of the smoking. That is lifestyle. That means that there are some restriction. Always
He
there.
should ask me directly if that
No,
he want to
if you
start.
cannot, if you don't have so much time, you could answer that. Okay, before I give you the answer, may I know that do you smoke? Okay, you smoke, but it will also you will also stop smoking totally after the lung transplantation, and also. And you have explained everything well that lung transplantation isn't a straightforward thing. You will have to be assessed, and after that, if you are eligible for the lung transplantation or not, that will be assessed, and after that, they will decide if they can transplant your lung or not. Everything was fine. This is not actually about the knowledge. This is actually about how can you manage and how can you give the information. Okay.
Now I feel more relaxed about communication, but I I start worry about long case.
Start.
Hello,
Hello.
this is Dr. Gabriel, doctor in the medical clinic. Are you Mr. Andrew Garfield, 28-year-old?
Yes, doctor, I am.
Okay, nice to meet you, Mr. Garfield. We are here today, as I understand you want to discuss with me some condition related to your brother.
Yes,
Is that
doctor.
correct?
I'm extremely worried because my brother has a condition called cystic fibrosis. I am so much worried after hearing that it runs in family. So I came to you. I want to know
Mm.
about my
I
condition.
appreciate your worries, Mr. Andrew, but can I know what do you want to know exactly about this?
Doctor, I am currently fine, but I heard that this runs in your family, that it come from the father and mother. And I am worried that if I have this condition or not.
So, Mr. Andrew, I appreciate your worries. This, as you said rightly, this condition runs in the family, but it doesn't guarantee if your brother have the condition that you will have it in the future. And as you said, you don't have symptoms. So, can I know why you want to do the
Doctor, my brother suffers a lot. He has a repeated bug infection in his chest, and he always frequently need hospital admission. And if I have this condition, if there is anything that I can do in advance to get rid of this condition, so I just want to know.
So, Mr. Andrew, there is, so I understand you want to go for investigation to know if you have the condition or no?
Yes, doctor. If I can go for that, I will go for that.
But before going for that, I want to explain to you more about this test. Is that okay with you?
Okay, doctor.
So, Mr. Andrew, as you said, you don't have symptoms. So, if you do the test and it comes positive, maybe it will bother your lifestyle and your thinking, and it will affect you psychologically. Do you get me, Mr. Andrew?
Okay, doctor. I can get you, but isn't there any test that can confirm I have this disease or not?
Actually, there is test, but usually it doesn't done for one who doesn't have symptoms. Do you want me to explain for you more about the test?
Okay, doctor.
So, if you want to do this test, you should be checked clinically by a group of specialists. They will test you clinically, and in this same time, maybe they will do for you a blood test by referring you to the gene doctor to do the test for you. If it come positive, it may become positive. But do you get me, Mr. Andrew?
Yes, doctor. And it comes positive, that means I have this disease, right?
And that's why I want to tell you that there is some positive result come with false positive. So
What
not
does this mean?
100%. Yeah, because this lab test doesn't guarantee 100% that you will have the disease, because there is a percentage, small percentage of the result that come positive, but actually you don't have the disease.
So what do you suggest, doctor? I am worried, and also I am going to marry recently, and I am worried if I pass this condition to my children, I will suffer myself, but I cannot see anyone to suffer like my brother.
Mr. Andrew, I can give you all the information, and you can decide by yourself. And if you need more information, I will give you information. And for your marriage, I can refer you for genetic counseling. They are in better place to help you out.
And do you think that they will be able to tell me that I will pass this, or I am having this condition and I will pass this condition to my children? One will
And
remaining.
there is lab and investigation can be done, but our result, as I told you, there is possibility that it give false positive, means it not 100% guaranteed. You should keep this point in your mind. Any more concern, Mr. Andrew?
Okay, doctor, suppose I have this disease. What is the chance of passing this to my children?
There is, in case you have the disease, you have a chance for passing this disease to your children by 25% for each time. And for that, I will provide you with website and brochure and material you can review, and I provide you with the phone number. You can call anytime for more information. Any more concern, Mr. Andrew?
No, doctor, I have learned, and I will take decision and give me all the information so I can read better about that, and then I will take decision. Time up.
Thank you, Mr. Andrew.
Okay, you have went everything fine. I don't have anything to talk about this condition. This patient's concern was if he is having this disease or not, and we have explained that there are some tests, and you are not a person who can do the test, but you will refer him to the genetic specialist, and they will do the test. But you only share the information that he is also having CFT or gene mutation doesn't mean that the patient have the disease. That was fine.
Is it correct? The percentage 25% for SEG generation?
Okay, actually, that is if the patient carries that abnormal gene and his wife also carries the abnormal gene, then there is a chance of passing this disease, or there is chance of developing disease in his children for 25%. And having this abnormal gene doesn't mean that he will develop this condition. Okay, if he has we have two gene, and if one gene is good and other gene is bad, he will not develop any symptom. Okay,
And I should explain this also.
you could explain this, that if you have this is called this is called autosomal recessive condition. That means we have two type of gene, and if both of them are abnormal, then there is chance of developing this condition. And also, if there is one good and one bad, then there is usually they will not develop this condition. Okay. And for cystic fibrosis, it is for just knowing that I heard that it is 1 in 25 patient in the Europe, they have this gene, but they are not developing this disease every year. They are carrying the gene. Okay, you did very well.
Okay, I should concentrate now on the long cases.